So here's why lip filler has gotten such a bad rap in social media and everywhere. And here's why also that, when it's done right and looks natural, you would never know it. So let's start from the beginning. Number one, bigger is not necessarily better. I mean, we've all seen it, unfortunately, where these people just go bigger, 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 and their lip anatomy and their facial structure and symmetry just doesn't fit that huge lip on their face. Number two, trying to copy someone else's lips. I mean, you pull a photo out on your phone, you show it to your doctor. Remember, again, this celebrity, whoever your influencer, whoever you're, trying to have your lips look like, could have a totally different lip anatomy structure where trying to get their lips just wouldn't work, and of course ends up making you look unnatural. Number three, going to the cheapest provider. I mean, Groupon, these, $2.99 filler days. Why this is so wrong in general, of course, I don't even have to get into. I mean, God, we've seen people now doing it at home. But remember, lip filler is doing it right and naturally is very technical, actually. So you certainly want to go to a medical provider who knows what they're doing, who's had a ton of experience. There's a lot of vasculature, blood vessels that you don't want to get into trouble with the lips, and knowing that anatomy is crucial for safety. And then bottom line, as we've seen, it's one of the easiest places because it's such a compact area for you to overdo it. So again, if you're just going to, the Groupon place, that can happen so easily and you can get into trouble. And now, speaking of something we see all the time is over treating the upper lip. You've seen, remember, natural looking lips should have a recommended proportion, which is the bottom lip is about 2/3 and the top lip is smaller, about 1/3. So when you're looking at, people who've got these sort of 50-50 lips, that looks completely unnatural. And then of course, when they're trying to get that pout on the upper lip, they end up getting way too big and they get that area of migration where you start to get that duck lip look. Another thing that I see in terms of lip filler is doing too much too fast. Again, because this is such a small area where you need that precision, the best thing to do is actually do it in a couple of treatments. Taking it going really slow, doing a little bit, especially if you're new to it, coming back next week, which I do with patients all the time, adding a little bit more if we need to. That's something that tends to work out long-term the best. And finally, what I see all the time is patients coming in or they're, other providers just treating the lip itself. You have to take into consideration for a natural appearance, the whole structure of the face, especially the perioral region, which is, of course, the chin, the marionette areas, the upper cutaneous lip. All that has to be balanced in order for the lips to look perfectly natural, seated where they are. You can't just treat the lip itself.